Hello students, today we are going to discuss inflammation. So today we will see what actually inflammation is and there are, how many types of inflammation can happen, what are the reasons for inflammation, all of that. Okay, so inflammation, it is derived from a Latin word inflammatio, is part of complex biological response of body tissues to harmful stimuli such as pathogens, damaged cells or irritants, and is protective response involving immune cells, blood vessels and molecular mediators. Okay, so actually it happens due to harmful stimuli, but once it is happening it is actually part of a protective response where our immune cells are involved, blood vessels are involved and several molecular mediators are also involved. Okay, so the function of inflammation is to eliminate the initial cause of cell injury, clear out necrotic cells and tissues damaged from the inflammatory process, and initiate tissue repair. Inflammation can be acute. Okay, so what actually acute means? Acute inflammatory response has a rapid onset and lasts a short while. Okay, it is very in a short time. It is very, how to say, it has a lot of severity. Like all of a sudden you feel inflammatory response and for a short while, and it is rapid. Okay, but when acute inflammation persists for a long time, okay, then it turns into systemic reaction, also known as acute phase response, which is characterized by rapid alteration in the level of several plasma proteins. And then in some cases, some diseases, it persists and immune activation can result into chronic inflammation, which often has pathological consequences. Localized inflammatory response. So, in localized inflammatory response, heat, swelling, pain, and tissue damage leads to formation of complement products, act as opsonin, anaphylatoxin, and chemotactic agent. So, what actually happens if you see the number one point here at the site of tissue damage? Causes release of vasoactive and chemoactive compounds factors, okay, that triggers a local increase in blood flow and capillary permeability. Okay, and at the site of tissue damage also you can see bacteria try to enter at the injury site. Permeable capillaries allow an influx of fluid, exudate and cells. So these capillaries, they allow influx of fluids. Here you can see the pink one are the capillaries. Then what happens? These exudates are actually complement antibody and C-reactive proteins. Okay, I'm sure you remember this from our unit 1 where I discussed with you the general idea of inflammatory response. Here in these slides we are going to discuss in way more detail. Then macrophages, neutrophils, all those go at the site of infection and uh, try to engulf the bacteria from the site of entry. Okay. Then phagocytes migrate to the site of inflammation at point 3. That is called chemotaxis. Phagocytes and antibacterial exudates destroy the bacteria. Okay, so at number 4 you can see how they are destroying the bacteria. All right. Localized inflammatory response, you can see in more detail here in this picture, where you try to see the tissue damage to your rightmost side, the pink color oval uh, diagram here, tissue damage. It leads to 3 parallel reactions. Okay, in the first one you see these the chemicals which are released are bradykinin, fibrinopeptides, and the third one is uh, plasmins. Okay, these 3 are released from the site of tissue damage, and then what they do, they go at the site of uh, vessel and mediate vascular changes and increase the permeability of blood capillaries. So by increasing the permeability, what it is actually doing, it is uh, helping the release of monocytes, neutrophils, lymphocytes from the capillary, so that they can go at the site of tissue damage and help them to eliminate the pathogen from the site. Okay. Then in the second picture, the second arrow next to it, you see the bacteria where the antibodies are acting. Then they are eventually also going for complement activation, which is helping in release of histamines, prostaglandins. All these are going to also cause the vascular changes in the capillary. Okay. And the activated macrophages, so these cells which are getting released from the vessel, they are ultimately going to the site of entry of pathogen where the tissue damage has happened, and they are engulfing the bacteria from the site of entry, and they are also releasing cytokines, which are in turn they are stimulating chemotaxis, which is going to release several chemokines. Okay. Also they are releasing these set of IL-1, IL-6, TNF alpha cytokines, which helps uh, to release neutrophils. Neutrophils generally are the first leukocyte to migrate into the tissue, followed by monocyte and lymphocyte. Okay, so that's what they are doing at the site of infection. In case of systemic inflammatory response, this is marked by the induction of fever, increased synthesis of hormones such as ACTH, okay, adenocorticotropic hormone, hydrocortisone, increased production of white blood cells, and production of large number of acute phase proteins in the liver. Okay, so look into this picture. What actually is happening here, local acute inflammatory response happened, okay, and then it is releasing these cytokines IL-1, TNF alpha, and uh, IL-6, and then it is stimulating the pituitary gland in our hypothalamus. Okay, in case of systemic inflammatory response, so one, they are releasing prostaglandins, which is causing fever, and then when the pituitary gland is getting activated, it is releasing ACTH, adrenocorticotropic hormone, which is going to stimulate adrenal cortex, uh, and that is going to produce corticosteroids. These corticosteroids are going to stimulate liver. So, and then that will result in acute phase protein, C-reactive protein, serum amyloid A, SAA, fibrinogen, mannose binding protein, and complement compounds. Okay. Also, these local acute inflammatory response directly can influence the liver and stimulate this acute phase protein production. All right. So these are two things. Then number three is production of IL-6, TNF alpha can also stimulate bone marrow, where the production of CSF is increased by stromal cell and macrophages, which is going to result in increased white blood cells count. Okay, so this is all about systemic inflammatory response. In case of chronic inflammation, which can lead to several pathological problems, an inflammatory stimulus persists, generating a chronic inflammatory response that has systemic effect, which have been associated most directly with type 2 diabetes. So it has been noticed mostly in case of type 2 diabetes, this chronic inflammation is the cause. Recent studies also raise a possibility that chronic inflammation exacerbate heart diseases, kidney diseases, Alzheimer's, and cancer. Okay, so what are the causes and consequences of chronic inflammation? So in the middle, the yellow one, you see the zigzag box, that is chronic inflammation where IL-6, TNF alpha, IL-1 beta, IL-1 B is being produced. Okay, so how it is being produced? These cytokines, these are produced because of some infectious causes and some non-infectious causes. Some infectious causes could be unresolved infection, intestinal microbes. Okay, these can result in the chronic inflammation. Then for non-infectious causes, if somebody is obese for a very long time, or they are having tissue damages, heart diseases, or osteosclerosis, these can result in chronic inflammation. Then as a result of chronic inflammation, tissue changes. Okay, so what kind of changes? Cell death, scarring, that is fibrosis, blood vessel growth, angiogenesis, and cell proliferation. Also, there are metabolic changes such as impaired insulin signaling, which can result in type 2 diabetes. So, what happens when there is tissue change and metabolic change? So, they can result in several systemic diseases such as organ failure, kidney uh, can be fail, and heart diseases, liver, then can lead to cancer, Alzheimer's. Okay, so that is why it is very deadly if somebody is having chronic inflammation. All right, so that's all for this unit. Okay, make sure I have been posting the questions in Google Classroom. So you finish your assignments on time and take care. Okay, bye.